So today we're going over how to use a TENS unit to treat sciatica or lower back pain. We're going to go over the exact placement and settings with Shelby here. She's going to help us learn exactly what it should feel like when you're effectively using a TENS unit for sciatica. If you've had lower back pain or sciatica and considered using a TENS unit, this video is going to be for you because as a doctor of physical therapy, when patients ask me, hey, I'm going to use a TENS unit for my sciatica, how do I do that so it's safe and effective? And the great news is a recent study showed that TENS units are still effective at reducing pain, and even better is that TENS units are way less risky compared to injections and medications. And so when you do it right, there's low risk and it can be effective to help relieve some discomfort and just give you some more comfort during your day. So what's great is that you can do this without a complex and fancy unit. I'm going to show you one that is a little bit older, but it's still highly effective and it's cheap, and so that works for everybody. I'm going to put the link in the description, and I'm going to go over kind of what I would do if I was using this unit. What we're trying to do is trick your body's nervous system in that we're going to calm down the painful fibers and activate the feel-good fibers. And so Shelby here is going to help us out, and we're going to have some fun, but this is the unit we're going to use. I'll put the link in the description, and let's get started. So a TENS unit can be safe, but there are things that you want to consider before you use it. And if when in doubt, consult your physical therapist or doctor. Don't place the pads over an area of skin of an open wound or bruising. Don't turn the intensity on too high. Don't rely on a TENS unit alone for treatment. You will always want to combine it with movement. And then don't use it if you have a pacemaker or are actively pregnant. So remember, with sciatica or lower back pain, you can have a lot of pain patterns. You can have pain in your back, you can have pain in your glute, you can have pain on the outer leg into the calf. And what I've done here is I've drawn the sciatic nerve and where it comes out of the glute and kind of goes down the back of the leg and splits at the knee. With sciatica, you're allowed to have pain any of those areas because sciatica is referred pain, and that the issue's happening in the back, but then you can feel it anywhere. And TENS units are designed to reduce pain and not really change what's happening at the back. And that's why typically I don't recommend that you only use this as treatment, but it can be a great way to reduce discomfort. And so in this situation, we're going to pretend Shelby has back pain and or sciatica, and her pain is most likely in her glutes. And so this is where I would apply it if she's feeling pain in this side of her body. The good news is in this area, there's just a lot of muscles, so we're not limited by anything. And we're going to apply this in a way that's going to be safe and effective for sciatica. You could do this lying down, you could do this sitting. I'm going to show for this purpose in standing. So in this situation, I'm going to go ahead and apply the electrodes. I like to do a crisscross pattern, so if or diagonal pattern. So I'm going to apply the positive and negative leads across from each other. You could do directly across, you could do side, it really doesn't matter. You could do any of those, really what you want to do. There's a lot of variables here that we can manipulate, but that's what I'm going to do with Shelby. And so in the unit itself, I'm going to go over the exact parameters that I would use with Shelby. All right, so I'm going to go ahead and turn it on. I've got the positive and negative leads here. Shelby should still be comfortable, shouldn't feel anything. For the pulse width, I'm going to be using anywhere between 60 and 100. For the mode, I'm going to be going continuous mode, and then the pulse rate, or the rate of the tingling, I'm going to be going a higher amount, so probably 100, 130, basically based off of Shelby's comfort. And so I'm going to ask her in a minute once I turn it up, and we might see a contraction or some tingling here. So I'm going to turn up one side first, and then we might see something. Shelby, let me know if you feel something, okay? And then I'm going to turn the other side. And so I like to just turn it up until you start to feel something. And then this next step would be, I want a strong tingle that's comfortable, but a good tingle before we get a muscle contraction. So let me know, Shelby, when you feel it. So this is all based off of you. So that's the intensity that I'm manipulating. She's kind of middle of the road here. Some people have higher tolerances. I've seen patients that require very little intensity before they feel it, and other patients I have to turn it all the way up and they're like, I still don't feel it. So just change your placements and change the intensity based on how you feel. Is that comfortable, Shelby? Yeah. And so in this situation, I would have Shelby be here. She could be now lying down on her belly or seated, or just whatever's comfortable for her. And I would tell her to apply it for 15 or 20 minutes in that strong tingle. It is very normal for your body to get used to it while it's happening, so it would have to increase the intensity a little bit. But what I don't want is to turn it up high enough that her muscles are actively contracting. That's not the intention here. So set your timer for 15 minutes or so. She's gonna be in this position. We're gonna use this TENS unit. You can move if you want a little bit. It's not gonna make it less effective. But if Shelby was a patient of mine, I would use the TENS unit, and then I'd be like, okay, now that you're feeling better, we're gonna be following it up with exercise, and what I like to use are nerve glides. And so I'll put the link to that in the description, or have it pop up here of a good video to follow this up with, or good exercise. So this is a great way to use a TENS unit for sciatica or lower back pain. You can apply this in the back, the glute, the hamstring, and the same principle applies. So don't really change the settings quite as much, just have the strong tingle and let it be comfortable, but it can be a great way to reduce your discomfort. So if you guys have any specific questions, go ahead and leave them underneath the video in the comments, and I will get back to you. But in this instance, I would just say, hey Shelby, we're gonna do this for 15-20 minutes. It feels great, good. She's gonna have less discomfort, and then she'll go about her day. If you guys have any questions, let me know. Hope you guys got something from this. And as always, guys, stay healthy, keep moving, and take care of yourself.